My name is Josh Piche. I'm an orthopedic spine surgeon here at the University of Michigan. I see adult patients, so patients anywhere from 18 and above, and these patients can present with a variety of spinal conditions. Conversations with patients, I really try and treat them like a family member and give them sort of the time and the space that they need and try and give them their diagnosis or news at a level like I would communicating with a family member, and try and be sensitive about it and as caring as possible. My typical approach for caring for patients is to always try non-operative management first, as much as we possibly can. So we like patients to do an adequate trial of physical therapy, medication, sometimes steroid injections, and if all of those things fail, then we discuss surgical management if needed. My goals for patients during and after treatment is always to provide the best possible relief of their symptoms. Patients most often come to me with back pain or leg pain or a combination of both of these. And being able to help relieve this, as well as restore their function, is my ultimate goal. Everybody's post-operative course after spine surgery is a little bit different. Oftentimes, especially after minimally invasive spine surgery, patients are up and walking same day after surgery. A lot of patients have pretty quick relief of their symptoms. It is possible to still have some surgical site pain or discomfort, sometimes up to a few months in certain patients, so everybody's recovery is a little bit different. I've been a part of Michigan medicine for quite some time. What I've always really loved about it is the teamwork. So I think one of the nice things is when patients present to us, whether it's in clinic or the ER, there's so many great teams of co-physicians and faculty that I work with that we can really give patients the best all-around treatment and look at things from multiple different perspectives, which is nice. Growing up, I would say I had an early interest in the medical field, and I think this started because my dad was a fireman paramedic. So growing up, I always heard his stories about going on runs and helping people, and I think that's what motivated me to go into a similar type field. And as I went through medical school or residency, I really developed a passion for surgery. I like the hands-on nature of it and the anatomy, and that's how I winded up doing spine surgery and where I'm at today. A lot of my research focuses on technology as well as minimally invasive spine surgery. We've been starting some projects looking at surgical outcomes in spine patients who have multiple sclerosis. This is important to me because my mom has been diagnosed with that, so this is an important area of research for me as well. One thing I'd like people to know about spine surgery is that I feel like historically it's often had a negative context where people often think, especially in the case of spinal fusion, that people often don't have improvements or can get worse. But I think that in today's day and nature, especially with minimally invasive spine surgery, for the right patient and the right indication, I would say a lot of people get significant relief of their symptoms. What makes me most passionate about the job is seeing patients back after surgery and they're happy and having a good outcome and feeling better than before. So patients that come to me with debilitating or severe pain or inability to walk, seeing them back in clinic if they're feeling great is really motivating and what inspires me to keep doing this.